Did you know that July is Minority Mental Health Awareness Month?
It's important for us as a society to recognise the impacts of mental health in minorities and raise awareness on this topic.
This is so important to our society because there are so many Black and brown people, like myself, who deal with mental illnesses that a lot of times go undiagnosed or misdiagnosed. We're told that we don't need to seek out a therapist. We don't need counseling. Tomorrow's a new day, deal with it.
As a full-time student, working part-time in order to afford food and rent, I was unable to pay for support and professional help with my depression. The waiting list for help was over a year long, and it seemed almost impossible to fight my mental health alone for that amount of time. I felt a loss of control and felt alone and unsupported. There were many times I considered quitting, giving up all hope.
I grew up and was raised in Hong Kong, where filial piety and keeping faith are two important values that a part of my culture holds. As a child, I had grown up with complete filial piety towards my parents that I became submissive and codependent. Suddenly, out of nowhere, they started seeing my abrupt behavior as disrespectful and disobedience. Convinced I was acting out, they would scold me and yell at me for not being deferent to them. I had also not been able to keep face because I could not keep my emotions at bay. I lashed out at all my family members and could not garner respect from my peers. When I had dealt with a mental breakdown during my late adolescence, I was not able to function the way most people do. I could not stand being in social situations and feared going out in public. Because I was undiagnosed with any mental illness at the time and thought my perception of reality was real, I consistently yelled at and became angry with my parents for not understanding me. This caused them to see me as a child who was acting out and rebelling against them.
When you are deprived of mental health care services and professionals, it can have a more significant effect on you both mentally and physically. This is an issue minorities face in contemporary society: lack of support, education, and discrimination.
And because of this, people are breaking down in silence. They're hurting. They don't know what to do, where to go.
I did not know at the time that stigma played a major role in society's misunderstanding of my mental illness when I was told that I was crazy. Now I can proudly say that I am on the road to recovery and I'm getting treatment for my mental illness. My family is supportive, and although my culture still treats mental illness with stigma, I'm so lucky to have support.
As a Black woman myself, I've learned to come to terms that it's not a sign of weakness to admit that I'm dealing with anxiety, postpartum depression. I sought out help, and now every day I'm managing my anxiety. I'm managing through my postpartum depression, and it feels good. It is healing to let others know. It is healing to bring awareness to mental illness within the Black and brown communities.
This is a real issue, one that thousands face in minority communities across the globe. This month is important. It shows us there are many different sides to mental health and the impact it can have on a person's life.
It's okay to not be okay. Let someone know. Seek help to be a better you.